this video, we'll concentrate on the second type of joint, the cartilaginous joint. So cartilaginous joints are made of cartilage, and so the two types, we're either going to see hyaline cartilage or fibrocartilage. And so these joints are either synarthrosis or ambiarthrosis. That means no movement or slight movement. And we can divide these into two main types, and it is based on whether they're hyaline or fibro. It's how they get their name. So what we're going to look at is made of hyaline cartilage, and that is known as synchondrosis. Can you see the chondro in there? Chondro means cartilage. So how can you remember that this is the cartilaginous? Chondro, and you just have to remember this one is the hyaline. And so two good examples of that would be that epiphyseal plate, and that one's only temporary. Remember, there is that cartilage there, and eventually those osteoblasts will catch up with them, and then we'll get that line when you stop growing on those long bones. And then the sternocostal joint, that is connecting the sternum and the costal ribs there, so that is also a chondrosis joint. All right, let's look at a picture. So here we are looking at the epiphysis and the diaphysis, and there in between we see that epiphyseal plate. Remember, if it's the plate, it's still growing, and so that is a chondrosis joint. Not a lot of movement in there, practically no movement. And so here we've got the manubrium, and this is your first rib, and we have that hyaline cartilage there, which is that costal rib. That's that joint there. So we get little to no movement with these, so this is a synarthrosis or ambiarthrosis there. The next one is the ones that are made out of fibrocartilage. So this goes back to that tissue, and so if you kind of remember that the pubic symphysis was fibrocartilage, and so that was that shock absorber cartilage there. So this is a symphysis joint, and again, it is little to no movement here, and so this one actually is more ambiarthrosis, so a pubic symphysis. Symphyses means plural, symphysis would be singular, so the pubic symphysis is a symphyses joint. And then your intervertebral disc are also going to be made of that fibrocartilage, and so we're going to get little to no movement there as well. So let's look at a picture of those. So your pubic symphysis here is holding your two pelvic bones together there. That's that little connector piece there. That is fibrocartilage, and it does allow a little bit of movement when a female has a baby. That do have to drop into the pelvis, and so this, you will see those coxal bones move, and so this allows those two bones not to connect or not to push against each other. So that's what that is. And then right in between your vertebra, you also have the intervertebral disc to stop those bones from rubbing up against each other. And these are all joints, and these are all fibrocartilage. So this is a symphysis joint made out of fibrocartilage. All right, so next video we'll talk about synovial joints.